Just question is, what are the changes brought to the salary structure of the employees?
The changes brought to the salary structure, are you referring to the heads of department issue? Right, okay. What we're doing, we're in the process of going through an organisational restructuring process, and we've started at the top of the organisation, so we now have a team of directors and a team of heads of department. And the heads of department are the first part in that overall structure. So we've started by reviewing the pay structure for the heads of department. What we've done is those individuals have been selected for their posts, and they have been given an increase in salary and an increase in responsibilities. But what we've done is we've done that within exactly the same cost envelope or management cost envelope as we had before. In fact, this is actually costing us less money than previously, because what we've done is, although their basic salary has been increased, their ability to do overtime has been decreased, so the amount of overtime that they can do as individuals has decreased. We've also taken a number of different allowances, such as risk allowance, off them as well. So overall, although they've got an increase in salary and their basic salary, overall we've done that within the overall management cost envelope that we had before. So it's cost us, as I said, it's actually cost us less. That's part of a very long process that should be completed by the end of December this year, 2011. And that process will review all salaries right across the organisation in a fair and equitable way. So although at the moment people think it's very unfair that we've started with the heads of department, as I've said, they've got a hugely expanded role. They now have responsibility not just for IGMH but right across Marley Health Services Corporation. We had to start somewhere, so we've started there, and we will gradually work our way through the whole of the staffing to get to a point where all staff have had their salaries ultimately reviewed by December 2011.
So what is the main reason for the delay during the overtime?
Overtime, right, okay. A number of factors. What I want to say first of all is I want to use this as an opportunity to apologise to staff, because clearly none of us wanted to be in a position where we weren't paying staff their overtime. We are now in a position where all staff will have received their overtime by tomorrow afternoon. Hopefully some will have received their overtime payments by today. It was a problem compounded by a number of different things. Firstly, we were waiting for some significant monies to be paid to us from other organisations, and there was a delay in them paying us that money, so we had an issue with the amount of money that we had available. So we had to make the decision to just pay their basic salary at that moment in time. We acknowledge it was the worst possible time because it was just before the Eid holiday, and none of us wanted to face that consequence, but unfortunately found ourselves in that very difficult position. The other issue was that because we'd gone through the month of Ramadan, the number of patients who actually come to the hospital during Ramadan, so the number of patients who come into the emergency room, the number of patients who come for outpatient department appointments, the number of operations that we perform is radically reduced. So therefore our income from patients also is reduced. So that was another compounding factor. The other compounding factor is that during Ramadan, as you'll be aware, people work shorter hours, and therefore the capacity to do more overtime at a higher rate is increased. So this month, at the end of August, our overtime bill was 4.8 million rupiah. It's normally 2 million rupiah, so it had gone up significantly in terms of the actual amount. So those three factors all compounded together to put us in a position where we were only actually able to afford to pay the basic salary at the end of August. And as I say, that has been sorted out now, and we are in a position where we can pay the overtime. We don't want to allow the same thing to happen at the end of September, and we're well aware that because of Ramadan and the way that overtime is paid, it's paid from it's calculated from the 15th of the month. So we know that we've still got 2 weeks of August's Ramadan overtime money. to be paid at the end of September. So we know that we're going to be facing a bigger bill again in September. So we're trying to make sure that we're putting everything in place to ensure that staff get paid their basic salary and their overtime monies at the end of September. We don't want to find ourselves in the same position again.
Can you identify the organizations that owe the highest amounts to the government?
I don't think it would be appropriate for me to specify exactly who those organisations were without having had prior approval from those organisations. So I don't think it's appropriate for me to actually say, but there are a number of big organisations who owe us money. I have to say as well though,
From the private or the government?
Depends on your definition of government and private really. So they're sort of private organisations really. But yeah, I'll describe them as private organisations. But I think it's fair to say as well that we also owe some big organisations and some very small organisations money as well. So we do recognise that we've got responsibilities to pay our debts to other organisations as well. And so some of those organisations are facing similar problems to us because we haven't paid them money that we owe them as well. I don't think it's appropriate for me to actually say that.
There are some issues about the mother national health insurance scheme in some other parts of the country. Did you find any issues with?
What do you mean? What issues?
Some payments from the mother scheme.
I think what I would say is that there are some big organisations who do owe us money. And we're working very closely with all of the organisations who we owe money to and who owe us money, because the most important thing in this is that we maintain good working relationships with all of the organisations that either do business with us or we do business with them.
So what's the amount of the government subsidy that you expect to get?
We get our government subsidy every month, and that is the same amount every month, and that is paid, generally speaking, towards the middle of the month, and that amount is 15 million roughly. But what I should say is that our staffing bill is more than 15 million.
Can you elaborate on the challenges faced in running the corporation?
The challenges faced in running Mali Health Services Corporation. I suppose the biggest challenge is the one that you've already highlighted, is that we are like many organisations, financially challenged organisation. What we are doing about that is we are working closely with our other organisations who we do business with, and trying to make sure that we develop good working relationships with them and a good understanding about our financial position. We're also looking at how we can become a more productive and effective organisation in terms of the way that we do conduct business, and so that is a challenge in itself. So we have a team of people who we call our turnaround team, who are working to try and bring about significant change in the organisation. At the end of the day, what we're all striving to do is to ensure that local people in the Maldives who want to access our services are able to do so efficiently, effectively, quickly and in an affordable manner. So that is what we're trying to do to ensure that we continue to provide services which are of a good quality. We know that we need to do a lot of work in improving accessibility, so people have to wait quite a long time to get an outpatient's appointment. So we're trying to look at how we can increase the number of outpatient appointments that we offer and the types of services that we offer. We're also very well aware that we have a very, very busy emergency room, and at the moment we don't have a proper triage system so that patients are prioritised, so we're working on that as well. We've got challenges in terms of making sure that we can attract high quality clinical staff, both nursing and medical staff, but we're working hard to make sure that we do that. So those are some of the key challenges that we are facing. We've got a lot of work to do on making sure that we are much more productive and that staff do recognise that they have an important part to play in the organisation. We're trying very hard as well to make Marley Health Services Corporation a place where people want to come and work, because that's really, really important to us. And if we've got a happy, well-motivated staff, then they will provide much higher and much better services to the local population, which is what we're about. But we've got a lot of work to do, and we acknowledge that not paying the overtime monies on time was not very helpful in improving staff morale. So we need to make sure that we don't allow that to happen in the future. So I think there are lots of challenges. It's a big organisation. It's an organisation that's very much in the spotlight, and we want to try and ensure that we turn this organisation round to make it a really positive organisation, and that patients, people who are accessing services, get a really good quality service when they come here on time, and that they can trust the people who are providing the care for them, and they don't have to wait a long time.
So comparing the services provided when you first came here, are you satisfied with the services provided now?
I've been in IGMH now since the beginning of February. I started initially working as the General Manager of IGMH, and I became the Managing Director of Marley Health Services Corporation at the beginning of July. I would say that we have still got a huge amount of work to do to radically improve the services. We've got some very good services. We've got some services that are understaffed. We've got some services where we've got gaps, in particularly in specialist doctors. There are lots of services that we'd like to provide, but until we become more productive and we are able to be on a more secure financial basis, we will not be able to provide those services. So our key aim is to try and make sure that we do become much more financially stable to enable us to provide different services, because we want to be able to increase the sorts of services that patients can access here in the Maldives. And just some examples as well in terms of how we want to improve things. At the moment we have a very, very busy labour ward, but if a father wants to be present at the birth of his baby, he can't be at the moment because we haven't got the facilities to allow that to happen. And in many other countries in the world, fathers are present at the births of their children. So we want to be able to get to a position very soon where fathers can be available, can be there when the children are being born, and if that's what they'd like to do. So we're trying to find ways of improving services, but that will take some time to do.
So what are your plans for the development of hospital?
Right, we've got a number of plans. We're pulling together a business plan as well for the next financial year about what we want to try and achieve. We've got some very key objectives, which some of them I've already highlighted. One is about being financially stable. The other is about improving the quality of services. We're also wanting to ensure that we've got affordable and accessible services. So when I mentioned before about increasing outpatient department appointments, that's an example of that. In terms of quality services, it's about making sure that when people need to be seen, they get seen straight away. So the example I gave you earlier about the triage in the emergency room is another example. We've got lots of plans about what we want to try and do to improve services. We're also looking to make sure that the work environment is better for staff. So we're looking to improve the canteen facilities, for example, and we want to be able to provide a catering facility in the hospital for patients who are staying in the hospital as well. You may be aware that we have also been in the process of renovating the old staff quarters, and that will provide 66 more beds for patients. A lot of those beds will be private rooms, private facilities, with much better facilities for people as well, because there is a huge demand for private facilities in the hospital. And we're in the process of you've probably seen there's a 12-storey building just outside IGMH, which again MHSC is renovating with a view to potentially having more private facilities in that building as well. So we've got a number of different plans that we're pulling together to ensure that we've got clear plans about where we want to go as an organisation and how we want to do that. We also, Marley Hazardous Corporation also has other entities involved as well, so the Haveeru Hospital and Billinghilly Health Centre, and we want to improve access and services at those different centres as well, and also the National Thalassemia Centre and Marley Health Centre, which is predominantly an immunisation and vaccination facility. So we're trying to look at plans to improve those facilities, improve access for patients, particularly those at Haveeru and Billinghilly. So at the moment there are fairly limited services at Billinghilly. We'd like to be able to increase those services, and also at Haveeru Hospital, where we've got a relatively new hospital which we need to use more effectively.
Is the hospital overstaffed or understaffed?
Is this hospital overstaffed or understaffed? In terms of clinical staff, we are understaffed, so we need to recruit more doctors, and nursing is less of an issue. We've got we're just below what we think we need in terms of establishment. I think the area where we need to make some improvements and look at efficiencies is in administration and management, and that's why we're starting there now. Going back to your previous question about heads of department, we've now streamlined the management structure, expanded people's roles across the organisation, right across Marley Health Services Corporation. We know that we've probably got more staff in administrative roles than we actually require. So the next piece of work is heads of department are going to be tasked with their directors to review their own internal structures in their own departments and look at where we can make some efficiencies.
Do you have any plans to lay off some administrative staff?
At this point in time, it's difficult to say exactly, but we are looking to see how we can review our numbers, because we do feel that we probably have more administrative staff than we may need in the future, but we're looking at that in a positive way and trying to make sure that we are doing it so that we are maximising our productivity.